Now, unfortunately, there are others that are so locked into the politics of this thing that they won't lift a finger to help their own people. And that's leaving millions of Americans uninsured unnecessarily. That's a shame. Because if they put as much energy into making this law work as they do in attacking the law, Americans would be better off. Americans would be better off.
Welcome back to Hardball. Now, I think that was the heart of it. That was President Obama speaking yesterday at a health care rally up in Massachusetts. The state, of course, made famous for its so-called Romney Care, which was used as a blueprint for the Affordable Care Act of the president's. As you heard there, the president is at war with Republicans who have made it their sole mission these days and years to destroy health care law. While the ACA has certainly seen its share of glitches or problems, the GOP has gone to great lengths to magnify and, in many cases, distort the real issues. Just look at the latest headline in today's Los Angeles Times. Quote, another Obamacare horror story debunked. Well, U.S. Congresswoman Gwen is a Democrat from Wisconsin, and Jonathan Gruber is an MIT professor of economics. He was a key architect of the Massachusetts health care overhaul. He also serves as an advisor to the White House and to Congress on the president's health care plan. Congresswoman, I want to start with you. I think somebody from Mars would watch the Congress these days and say, what are those people so angry about? Fighting like mad from the Republican side with all this anguish and almost frightening anger. And I get the feeling it's not about whether the program's working or not. What they are angry about the Democrats and angry about the president and angry about this health care program is they don't like the effort. They're angry that anybody tried to make sure that the 40 or 50 million people sitting as working people in the emergency room looking for some health care are being taken care of or being thought after. They don't like that effort, and that's why they're really angry. Not that they're glitches. They don't like trying to do something for these people because they don't want to lift themselves up off their butts to do it. Your thoughts?
Oh, Chris, absolutely. When you stop and think about the Ryan budget, for example, we would have seen 14, 15 million people thrown off Medicaid. There's no secret that Republicans do not like the notion of universal health care. And the Affordable Care Act is just another iteration of that. We saw this happen with the rollout of Social Security, Medicare, Medicaid, any of these so-called entitlements Republicans have not liked. They want government to be the handmaiden of business. They just don't believe in the American people taking care of each other.
You know, when I listen to people like, especially Ted Cruz, I hear every word he speaks could just as well have been written in attacking Social Security back in the mid-30s, early 30s, attacking Medicare in the early 60s and Medicaid. The same lingo. This is government socialism. This is Fidel Castro with an American accent. Let me go to Jonathan Gruber. I've heard great word about you, sir, and what you know. And I want to go to that question to you. I know you're an analyst and an expert, but what is the anger about when you see these Republicans gnarling away and snarling away at the Secretary of Health and Education and Welfare the other day? What are they angry about?
Chris, I can't pretend to read their minds, but let's look at the simple facts. The simple facts are that Obamacare is built on Romney Care, and Romney Care is built on conservative notions proposed by the Heritage Foundation in the early 1990s to oppose the Clinton health care reform. Massachusetts Governor Romney adopted those ideas and made them the centerpiece of his law. President Obama, despite the fact in the election he was opposed to the mandate, recognized it was a system that had worked well in Massachusetts, with us covering 2/3 of our uninsured citizens, and it was broadly popular. He, to his credit, changed his views, adopted the mandate, and once he put his name to it, suddenly the right wing disliked it. One key fact to keep in mind, Chris, when Governor Romney signed this law in 2006, on the stage with him was a speaker from the Heritage Foundation talking about what a victory this was for conservative principles. Suddenly it's the devil's work. I don't see any argument other than it's just ugly partisan politics.
Okay, let me you to start with this question. Among the president's problems are that he again and again said that if you have an insurance policy, and that meant most people thought they had a good insurance policy, they wouldn't have it, felt they could be left alone. Those people bought their insurance on their own, not through their employer. Now they're being told by their insurance companies that those policies aren't going to exist anymore. What do you think was wrong, if you did think anything was wrong, in the way the president sold the idea that you'd be held harmless, you'd be left alone with no paperwork or whatever if you had a good policy?
The president probably should have made a somewhat vaguer statement about, in general, you'll be left alone. Because look, the bottom line is 80% of Americans get insurance from their employer or the government, and they're not affected. We're talking about the small slice, maybe 5 to 6% of Americans who buy insurance on their own. And even within that small slice, about half of those people will be able to simply replicate what they have today. Maybe the name of the plan will be different, the deductible will change a little bit, but they can just go out and buy pretty much what they have today. It's a very small slice of Americans who will literally have to change their insurance plan, and that's largely because they're in crappy insurance that doesn't really protect them against real financial risk, so we're asking them to buy real insurance.
So you can say it's junk insurance they have, most of them, that they're having a problem today. They didn't really
I don't know if it's most of them, but it's, yeah, a large share of them don't have a good policy either. It's a policy that doesn't cover hospital care, a policy that doesn't cover mental health, or a policy that has a $15,000 deductible, which doesn't protect them from bankruptcy.
Well, if that's the case, it's solid. Let me go back to Congresswoman Moore. You know, I noticed something in the paper. I don't like to get ethnic all the time, but sometimes it seems relevant. Did you notice that there's a racial divide in the attitudes of people towards Obamacare? I wouldn't be surprised if part of that racial divide, without jumping to too many conclusions, was based on it was called Obamacare. Your thoughts?
Oh, absolutely. I think that the first African-American president certainly has had a rough time overcoming some of the racial stereotypes and prejudices that many people have. But the reality is, Chris, that a great disproportionate number of people who are going to benefit from the Affordable Care Act are in fact African Americans because they are in the lower income echelons of our society. So they're going to benefit by the expansion of Medicaid or they're going to benefit by going into the exchange and the individual market because they're employed, they're disproportionately unemployed and don't have employer-based insurance, or they're working for small, strong businesses that can't or haven't insured them to this point. And so there's no question that African Americans are going to enjoy a great benefit from the Affordable Care Act.
I love it. I love these polls because they put the big lie to the fact that the right wing always says, you know, African Americans are on welfare, they're on the dole, they don't want to work. In fact, people who are on welfare are covered by Medicaid and have been covered by Medicaid, the people at the bottom. It's the working person who gets up and catches the bus and goes to work 40, 50 hours a week that'll benefit from this. And they know it, and the other side knows it and doesn't give a damn. Let me get back to the expert here, Jonathan Gruber. When will we get to a point, if you're an optimist, I hear you are, what will be the month, hopefully the month, when the victories scored by the health care bill, the Affordable Care Act, outweigh the criticisms, where people say, you know what, I think most Americans are happy with this system?
Chris, to be honest, I think that's going to be well into 2014. We have to recognize the slow pace. Yes, well into next year. We have to recognize the slow pace of enrollment. In Massachusetts, it took about a year for us to ramp up from when people could first pay for premiums and sign up. That first month, 123 people signed up. By the end of the year, it was 36,000. It's going to take a while to ramp it up. The key date to keep an eye on, Chris, is that date of March 31st. That's the date by which people have to have insurance to avoid the individual mandate penalty. I think once we get past that date and we have a lot of people insured, people will start to recognize that the winners really outweigh the losers. But that's only if we're willing as a society to recognize the importance of aggregates and not anecdotes. There's always going to be anecdotes about people complaining about this or losing in this dimension. We have to recognize the winners are going to vastly outnumber the losers. We can't let the noise over the few losers swamp the gains by the enormous number of winners.
Well, there's a reason why Reader's Digest is popular, by the way. Anecdotes do carry the day an awful lot. People are used to anecdotes. Let me ask you a political question. The second Tuesday, the first Tuesday after the first Monday of November next year, which is the election day, will this thing be settled by then?
It depends what you find is settled. Oh, I'm sorry.
Go ahead, Congresswoman. You first, because you're in the business.
I think Democrats and Republicans are both at risk in November of 2014. But right now, the public is more angry at Republicans for shutting the government down, and to the extent that they have done it to prevent people from getting health care is not inuring to their benefit. I mean, as a Democrat, I'm hoping to really exploit the foolishness of Republicans and to demonstrate to the American people that they don't deserve. They need to be deselected for their lack of leadership and for their unwillingness to bring a common commodity such as good health care to people.
It's great having you on, Congresswoman. Thank you. U.S. Congresswoman Gwen Moore.